Hello there, ProActive community. I'm Dr. Emily Evans, and I'm a physical therapist here with ProActive. I am so excited to be able to offer ProActive at Home, which is our service that we get to come to your home and work with you in your home environment. Because my passion is for keeping our aging population as independent and free of falls in their home for as long as they're able to safely do so. My background is in skilled nursing facilities, assisted living facilities, and home health. And so, kind of what makes ProActive at Home a little different from the traditional home health agencies is that we are not a home health agency. So, we do not require you to be homebound like other home health agencies would. So with that, because we want to, again, we want to keep you as independent and as upright as possible. So we want you to be independent in the community. We want you to be active in the community. We want you to be able to enjoy doing the things that you love to be doing and staying active and healthy. It just may be that we work on things at home that may be a little tough for you in your home environment. So what a traditional home health agency would do is they would send out a physical therapist. They would do your evaluation, and then more than likely you'll get a physical therapist assistant, possibly even a PT coming back to do your treatments, and then a PT again in 30 days for your reassessment visit, and then in an additional 60 days to do your reassessment visit. Well, with ProActive at Home, you get a physical therapist every single visit from start to finish. So we'll be there for a full hour in your house, maybe even a little bit more for the evaluation, because we want to make sure that we cover everything in the evaluation that you might be having trouble with in your house. And then each treatment will be there for right around an hour, working on everything, any and everything that you need help with, either in your home or right outside of your home. Whereas with a traditional home health agency, they're a little bit pushed for time just so that they can meet their productivity standards. And so they may only be there for 30 or 45 minutes in your home. And then they got to skedaddle to get out to their next patient, drive to their next patient. Well, what we're doing with ProActive at Home is that we are limiting the number of patients that we see at one time, because we want to be able to give the quality and quantity treatment that each one of your visits deserves. And so we want to be there for the full hour, and not just to run through a standard set of exercises and take your vital signs. And then sometimes that takes up to 30 minutes, just getting a few exercises in and taking your vital signs. So what that additional 15 minutes, half an hour is going to allow us to do is practice those things that you have trouble with in your home, whether that's getting up out of your bed or getting up out of a chair that's a little bit lower, or reaching in a cabinet, reaching up in a cabinet that might be a little bit difficult for you as far as balance goes. If you've got any steps to get either in or out of your house or your garage, or if you have a basement, need to access it, or just walking around your grounds. If you enjoy gardening and like to being outside, and enjoy, just again, walking around outside on uneven surfaces, but you're feeling a little unsteady with that. Those are all things that ProActive at Home can help you with. And so starting from the beginning, ProActive at Home, we would come out for your house to do the initial evaluation by a doctor of physical therapy. So we would run through all of those things. We'll do quite a little bit of talking because we want to get to know each other. I want you to feel comfortable with me being in your home. And then I want to really get to know what you have problems with working on inside of your home, all of your difficulties. And so then based on kind of what we talk about, we might see how you do getting in or out of your bed, in and out of the shower, in and out of different cabinets or different closets in your home. Again, going up and down any steps that you may have. And then based on those assessment findings, we'll establish a plan of care together, right? Because we want to goal set, because we want to make sure that what we're going to be working on and the goals that we're going to be working towards are meaningful for you, because we don't want to just set goals and okay, well, this is why we're doing this. And hopefully it's going to help with A, B, and C, the difficulties that you may have. We want to establish meaningful goals for you so that our time together is well spent and beneficial for you. And then after we come up with your goals, we'll establish kind of the treatment options that we'll work through. And that might be, we're looking at some muscle strengthening issues, or we're looking at some muscle flexibility issues, because sometimes when our muscles are tight, they can't be strengthened like they should be, because they just don't have the flexibility and the movement that they need to go through that range of motion required of them to do certain activities. So again, we'll look at your strength, we'll look at the flexibility in your muscles, we'll look at your balance, going through several different balance tests, and then again, all of those functional mobility needs, so getting in and out of bed, up and down out of a lot of different chairs and surfaces. Again, just anything that you're having difficulties with, we'll take a look at those and see how we can help make those easier for you. And then if you're a little bit uncomfortable with your balance, how we can improve the confidence with your balance. So once we run through that evaluation and we set your goals, we'll talk about how many times a week we'll come out to visit you. And again, everything's going to be provided there in your home, whether that is your initial evaluation, and then all of your treatment sessions, they're all there in your house, because we want to make it functional for you. And so once we get through goal setting and setting up our plan of care, then we'll just come back again and work with you on your next visit. You may want your family present for the first visit or two, that initial evaluation, because sometimes they can see things a little bit differently than you can, especially if you're home alone. Well, what do you think about this? Here's where I see that you're having a little bit of difficulties with. Maybe we can work on this. And that's even car transfers, being able to get in and out of the car to make it easier to go to doctor's appointments, or just to make it easier to get access to the community. If you like to be out and independent in the community, how can we get you in and out of the car a little bit easier? And so those are all different types of things that we can work on with ProActive at Home. I am so excited that you found our page and we had the opportunity to discuss what ProActive at Home is about, and we hope to look forward and work with you soon on all of your mobility needs within your home.